Health Talk made simple by Aziz. Hello everyone, and welcome. Today we're going to talk about something super important inside our bodies. Our kidneys. Think of them as two of your body's best friends. You have two of them. They are shaped kind of like beans. If you were to make a fist with your hand, that's about how big each of your kidneys is. They hang out in your back, just below your rib cage, with one on each side of your spine. So, how exactly do your kidneys clean your blood? It's a pretty neat process. Think of it like a coffee maker or a very smart kitchen strainer. When you make coffee, you put coffee grounds in a filter, then pour hot water over them. The filter keeps the yucky grounds in and lets the delicious coffee flow through into the pot. Your kidneys work in a similar way. Blood flows into your kidneys through tiny tubes. Inside the kidneys are millions of tiny filtering units called nephrons. These nephrons are like the super tiny holes in the coffee filter. They're smart enough to know what to keep and what to get rid of. As blood passes through these nephrons, the good stuff, like red blood cells, proteins, important nutrients, is kept in the blood. The bad stuff, however, like waste products from your food, extra water gets filtered out. This waste and extra water then becomes urine. The urine flows out of the kidneys, down two thin tubes called ureters, and is stored in your bladder. When your bladder is full, you get the feeling that you need to go to the bathroom. Now that we know how amazing our kidneys are, let's talk about what happens when they get sick. Sometimes the kidneys can become damaged and can't filter blood as well as they should. When this damage happens slowly over a long period of time, months or even years, it's called chronic kidney disease, or CKD. The word chronic just means that it's a long-lasting condition. It's not like a cold that you get over in a week. CKD is a slow process where the tiny filters, the nephrons, get damaged and stop working. This means waste and fluid can start to build up in the body. Imagine our coffee filter example again. What if the filter got tiny tears or became clogged with old coffee grounds? It wouldn't work very well. Either it would let grounds into your coffee, or it would get so clogged that the coffee couldn't drip through at all. With CKD, the kidney's filters get damaged in a similar way. They become less efficient at cleaning the blood. The tricky part about CKD is that in the early stages, most people don't feel sick at all. So, what are the things that can harm the kidneys and lead to chronic kidney disease? There are a few main culprits that doctors see most often. The two biggest causes are diabetes and high blood pressure. These two conditions are responsible for about 2 out of every 3 cases of CKD. First, let's talk about diabetes. This is a condition where your body has too much sugar in its blood. Over many years, this high blood sugar can act like sticky goo, damaging the tiny, delicate blood vessels and filters inside your kidneys. This damage makes it harder for them to clean the blood properly. The second major cause is high blood pressure, which is also called hypertension. Think of your blood vessels as hoses and your blood pressure as the force of the water flowing through them. If the pressure is too high, it can stretch and weaken the blood vessels all over your body, including the very important ones in your kidneys. This constant high pressure can cause scarring and damage to the kidneys' filters over time, making them less effective. Managing both diabetes and high blood pressure is one of the most important things you can do to protect your kidneys from harm. Besides those two big ones, there are other causes as well. Some people get CKD from problems that are passed down in their families, which is called a hereditary cause. For example, polycystic kidney disease causes many cysts, like little water balloons, to grow on the kidneys and damage them. Another cause can be long-term infections or blockages in the urinary system. If urine can't flow out of the body easily, it can back up and put pressure on the kidneys, causing damage. This could be from a kidney stone or an enlarged prostate gland in men. To help understand how CKD is progressing, doctors have created a system with 5 stages. These stages are based on how well your kidneys are filtering your blood. Doctors figure this out with a simple blood test that measures a waste product called creatinine. From that, they can calculate a number called the estimated glomerular filtration rate, or EGFR for short. The EGFR number tells you what percentage of function your kidneys have. A higher number is better. Think of it like a grade on a test. The closer to 100, the better the kidneys are working. Let's, go through the stages one by one. Stage 1. The EGFR is 90 or higher, which is considered normal or high function. However, there are other signs of kidney damage, like protein in the urine, or physical damage seen on an ultrasound. At this stage, you feel perfectly fine. The goal here is to find and treat the underlying cause, like high blood pressure, to slow down any further damage. Stage 2. This is when there is a mild loss of kidney function. The EGFR is between 60 and 89. Like in stage 1, many people still don't have any symptoms. The focus remains on a healthy lifestyle and managing conditions like diabetes and high blood pressure to keep the kidneys as healthy as possible for as long as possible. Stage 3. This stage is split into two parts, 3A and 3B, and it represents a moderate loss of kidney function. In stage 3A, the EGFR is between 45 and 59. In stage 3B, it's a bit lower, between 30 and 44. At this point, some people might start to feel tired or notice some swelling. This is often the stage where people are referred to a kidney specialist, called a nephrologist. Diet changes and medicines may be needed to help manage complications like anemia or bone problems. Because chronic kidney disease is so sneaky in its early stages, it's important to know what signs to look for, especially as the disease progresses. In stages 1 and 2, you probably won't feel any different at all. But as you move into stage 3 and beyond, your body might start sending you some signals that things aren't quite right. One of the most common early feelings is just being more tired or having less energy than usual. This can happen because the kidneys aren't making enough of the hormone that helps create red blood cells, leading to a condition called anemia. Other signs can start to appear as well. You might notice swelling called edema in your legs, ankles, feet. This happens because the kidneys can't get rid of extra salt and water, which then builds up in your tissues. Some people find they have to go to the bathroom more often, especially at night, or their urine might look foamy or bubbly, which can be a sign of protein leaking into it. Other possible symptoms include trouble sleeping, dry and itchy skin, a poor appetite, or even muscle cramps. It's important to remember these signs can also be caused by many other things, but they are worth talking to a doctor about. So, how do doctors check on your kidneys and find CKD? They use a few simple and painless tests. The first is a blood test. They take a small sample of your blood and check the level of creatinine, which, as we mentioned, is a waste product. Healthy kidneys remove creatinine from the blood, so if the level is high, it's a clue that the kidneys aren't filtering well. From this, they calculate your EGFR to know your kidney function percentage. The best news about chronic kidney disease: you have the power to protect your kidneys. Think of yourself as a superhero for your own body. By making healthy choices every day, you can make a huge difference. The most important tip, especially if you have diabetes or high blood pressure, is to manage those conditions. Take your medicines as your doctor prescribes. Check your blood sugar regularly if you have diabetes. Keep your blood pressure in a healthy range. This is the #1 way to shield your kidneys from further harm. Next, pay attention to what you eat. Cut back on salt. Too much salt raises blood pressure and makes kidneys work harder. Prefer fresh foods over processed or packaged foods. Eat a balanced diet: fruits, vegetables, whole grains. If disease is advanced, follow specific advice from your doctor or dietitian. They may ask you to limit protein, or limit potassium, or limit phosphorus. Stay active and keep a healthy weight. Walk, swim, ride a bike. Aim for about 30 minutes most days. You don't need to be a marathon runner. This plus a healthy diet reduces strain on your heart, blood vessels, and kidneys. Finally, avoid a few things. Quit smoking, one of the best steps for kidneys and overall health. Be careful with over-the-counter pain medicines, ibuprofen, Naproxen. Occasional use is usually fine. Long-term daily use can harm kidneys. Always talk to your doctor about safe pain relievers. Knowing when to reach out for help is a really important life skill, and it's especially true when it comes to your health. Since kidney disease can be so quiet in the beginning, regular checkups with your doctor are your best defense. This is even more critical if you have one of the main risk factors for CKD. If you have been diagnosed with diabetes or high blood pressure, it's essential that you see your doctor regularly to make sure those conditions are under control. Your doctor will likely check your kidney function with blood and urine tests at least once a year as part of your routine care. You should also make an appointment to see a doctor if you have a family history of kidney disease. If your mom, dad, or siblings have had kidney failure or other kidney problems, you might have a higher risk. Just letting your doctor know about your family's health history can help them know to keep a closer eye on your kidney health over the years. It's not something to be scared of, it's just being smart and proactive. Catching any potential problem early gives you the best possible chance to manage it and stay healthy. Beyond regular checkups, you should definitely see a doctor if you start to notice any of the signs or symptoms we talked about earlier. Living with a chronic condition like kidney disease might sound scary, but you can still live a full, happy life. The key is to take an active role in your health and build a strong support system. This starts with learning as much as you can. Understand your condition, understand your stage, understand your treatment plan. Your healthcare team can help. Doctor, nurse, dietitian. A dietitian can help you pick foods and find delicious recipes. It's important to have people you can talk to. Living with CKD can feel overwhelming or lonely. Family can make all the difference. Friends can make all the difference. Tell them how you're feeling and how they can help. Sometimes just having someone listen is enough. Join support groups online. Join support groups in person. Sharing experiences and tips is encouraging. You are not alone. Create a simple, steady routine. Set reminders to take your medicines at the same time each day. Plan your meals for the week. Schedule physical activity you enjoy. Normalizing these habits reduces stress and keeps you consistent. Every small positive step adds up. It slows disease progression and helps you feel better. This journey is a marathon, not a sprint. There will be good days, there will be challenging days, but there's so much reason for hope. Health Talk made simple by Aziz.